suggested that it had been a dire week for the NHS in England, and today we've got the figures to prove it. A&E waiting times during December in England were the worst since the target was introduced in 2004. Official figures show 85.1% of patients were seen in 4 hours, which is well below the 95% target. Last week, 55,000 non-urgent operations were cancelled as winter pressure puts the NHS system under strain. And there is a growing consensus among healthcare professionals that a new long-term funding solution for the health service needs to be found. And now some politicians are also joining the debate. Tory MP Nick Bowles has called for taxes to be increased to pay for NHS funding. And at Prime Minister's questions yesterday, Andrew Morrison called for a royal commission on its future. He proposes rebranding national insurance as National Health Insurance, with funds going directly to the NHS. At the same time, the NHS Confederation has commissioned a comprehensive study into the funding needs of health and social care over the next 15 years. And Chris Hopson, the head of NHS Providers, which represents the majority of NHS trusts in England, had some strong words for the government about the future of funding too.
We have now reached a watershed moment where it's very clear the NHS can no longer deliver the standards of care that are set out in the NHS Constitution. We therefore have a really important decision to make, which is, do we abandon those standards, which were incredibly hard fought to gain those standards in the 2000s, or do we make the decisions on the long-term funding of the NHS and social care to ensure the NHS has enough money to meet those standards?
Chris Hopson. We're joined now by the Shadow Health Minister, Justin Madders, and I will come to you in just a moment. But first of all, Graham Brady, A&E waiting times in England in December were the worst on record. Is that acceptable?
Of course it's not acceptable, but we've got to remember the NHS is doing more than it's ever done. It's doing things better than it's ever done.
How can you be doing things better if the A&E waiting times in England are the worst on record?
Because the real story here is one of growing demand, an ageing population, more expensive kinds of healthcare that are now available. That's all marvellous, but it creates challenges for the NHS. And it is a big long-term challenge that we need to work together to try to resolve.
Well, it's not a long-term challenge, is it? It's a challenge right now. If you listen to NHS bosses, they're not just talking about a winter crisis, and we have had these crises year on year. They are talking about a service that is no longer going to be able to keep standards safe for patients. A watershed moment, Chris Hopson actually said. So I ask you again, we've known about the challenges of an ageing population. So is it acceptable that the NHS is struggling the way it is?
And spending continues to increase. But I think the calls that you're highlighting here this morning are absolutely right. People looking to the future, looking at ways to find a more sustainable way of dealing with this. I'm very sympathetic to the call that was first made by Maurice Sartre, I think, for a Royal Commission to be established into the future funding of the NHS. It is a hugely important thing for us to get right for everybody in this country.
Right. I mean, the top Oxford Cancer Hospital, one of them, saying they'll have to delay or cut life-prolonging treatment due to a chronic shortage of specialist nurses. Is that acceptable?
Well, of course, these are all things that have to be addressed. The NHS is recruiting more doctors, it's recruiting more nurses. We have more doctors and more nurses than we've ever had.
But not enough to deal with, as you say, the increase in demand and the number of elderly patients, which we've known about.
And that is about the challenges for the health service. It's also about the challenge in social care. It's about making sure that we knit the two things together, something my area, Greater Manchester, is in the forefront of, trying to make progress in making sure health and social care are seen as part of the same picture, something which has now been, of course, established more firmly in the reshuffle with the department being renamed with responsibility for social care.
All right, well, let's look at the solutions. Justin Madders, what is Labour's solution specifically when it comes to funding year on year?
Well, we've been very clear, and I think we're hearing today quite a lot of the people involved in the NHS are actually coming around to our way of thinking, including some Conservative MPs, that actually it is about the funding at the core of it. And we have pledged at the last election that we would put an extra £6 billion a year in. And you've got to look at the historical...
When would that start? You did say in your manifesto, I have it here, actually it says £5 billion for healthcare being put into the budget. When?
Well, obviously we'd have to get a budget passed.
Sure, but in your plans, when was that £5 billion? When would that £5 billion be spent?
Well, it will be from the first year of a Labour government, and it's about actually the long-term funding squeeze that we've seen over the last 8 years, which has seen us increasing funding by about 1%. When, as we know, for the reasons that have already been outlined, demand has gone up by about 4% a year. So we want to get it back to that kind of level and stabilise the situation.
So £5 billion extra a year into the healthcare budget in the first year of a Labour government, which would have been now if you had won that election. The Conservatives have said they would increase it by a minimum of £8 billion a year by 2021-22. So do you accept that actually both parties are quite close in terms of the extra funding that's being committed?
No, I don't, because we would have already been putting measures in place now, and what we're seeing at the moment, obviously the December statistics are the worst on record, and this is before we've got to the appalling stories we've heard about in the last couple of weeks. We need the funding now. We need to stabilise the situation now. Staff are leaving in droves because they're absolutely sick and worn down by the pressures that they're facing. We need to absolutely give them confidence that there is a future and a hope for the NHS.
Right, so £5 billion immediately would have been put in by Labour. What other extra measures?
Well, we would have increased the social care budget by a couple of £1 billion a year, and this £5 billion would have been in every single year, and obviously in the longer term.
So you would have increased it every year? By 2021-22 by £5 billion.
No, it's an extra £5 billion every year. No, not an extra £5 billion on top.
Just to be clear, right? But actually, you committed, the Tories committed £8 billion a year, but not until 2021-22. And that's the difference. You wouldn't be doing anything, and you're not doing anything right now.
There is more money going in now. There will be more money next year and the year after.
But not that amount.
And by 2021, it will be an extra £8 billion.
Do you think it should be more now? Over and above what's been committed to deal with this particular crisis?
I think we need to do what is necessary to deal with the current situation.
Which is what?
Well, it's not for me to manage the National Health Service. We need to do what is necessary.
Is that more funding, though, in your mind?
Well, it might be, and of course more money was announced in the budget. There is a response. But I think the problem, when Justin and I can sit here talking about 8 billion or 5 billion, whether it's this year or next year, it is a much more fundamental question than that. It is whether this is a sustainable way of funding the NHS in the long term. And I think the public really understands that.
All right, well, let's look at the sustainable funding, because Nick Bowles, your colleague, has suggested that it is time for a hypothecated NHS tax. So tax that goes directly into the health service to pay for healthcare in England. Do you agree with that?
I heard him on the Today programme this morning. I thought it was a very interesting proposition to use what has always been, in a sense, misnamed the National Insurance Fund and make it a National Health Fund. I thought it was a very interesting idea. I'd certainly be very interested to look at it.
Right, so you might support that idea that going forward and taxes would go up and it would then be targeted directly to healthcare.
And I think Nick's point was also that you might find years where there was a surplus in the fund and the fund could build that up. There might be years when there was more revenue available to spend and some years when there might be a little bit less, but it would at least make it a predictable pot that the NHS could rely on, and we could all see where that money was coming from and where it was going to.
Do you support the idea for a hypothecated tax for healthcare?
I'm less concerned about what you call the tax, about actually getting the money in the system, and I think as long as we make clear, which we did at the last election, that we would raise taxes, we'd reverse the corporation tax cuts, we'd increase income tax for the highest earners, and we would use that money to pay for extra funding in the NHS. I think that's the actual nub of this issue. Right,
you say it doesn't matter what it's called, but the complaint has been that even if you increase taxation, if the public knows that that extra money is definitely going to healthcare, they'll feel more reassured about paying it. Do you accept that? Yes, and that's what we did in the 2000s, and you can see the results of that. We had much improved performances, the greatest satisfaction levels in the history of the NHS by the time we left office. Right, it wasn't hypothecated in quite the way that's being discussed today. It wasn't, but it was different for the very reasons that people thought it was cynical to do so. So do you support an idea of a hypothecated tax as one idea of a long-term solution for funding the NHS? Well, I think the main point is actually that we have to increase the spending on the NHS, and the only way to do that is through increasing taxation, and that is our position. And do you think it's sustainable to get all your money from higher taxpayers and from corporations? Well, I think that's what we set out on our manifesto. I think that there are a number of reasons why we wanted to have those particular groups paying a little bit more. I think that's
perfectly reasonable position, one that we were confident to take out to the country.
And what's wrong with that?
Well, all the evidence is you tax higher earners too much and you tax companies too much, you actually get less revenue in, not more. And that's been seen time after time. So I'm afraid that if ever we were to have the tragedy of a Labour government, the effect would be there would be less money available to spend on the NHS.
What do you say?
Well, this is the line we get trotted out every time. I mean, I think what it suggests is actually we're not doing enough to crack down on tax avoidance, and that really is a big issue in itself.
Right, except, of course, that's also the line that's trotted out by successive governments in terms of tax avoidance. When it comes to the long-term funding of the NHS, would you like to see spending on healthcare go up as a proportion of GDP? What percentage should it be?
Well, we need to get up to the average of similar countries such as Germany.
And what is that level?
It's about 9.9%.
It's higher in Germany. It's closer to 11%.
Yeah.
Is that what you would like to see here?
Well, I think that's an ideal, but at the moment we need to stabilise the situation and deal with the demand that we've got.
Right, but looking ahead, you would be committed to Labour increasing the percentage of healthcare spending as a proportion of GDP to 11%.
I've not made that commitment. What we've actually got to do is look long term at what the demands are, as the NHS Confederation
well, that is a long-term solution, isn't it, to increase it?
That's a comparison with another country. We've got to actually look at what the demands are in this country over a 10, 15, 20-year period and plan accordingly. And I think that's absolutely what this government should have done 8 years ago.
Well, some Tories, of course, are actually proposing that now. So do you think in the way, when we've looked at the figures of 5 billion extra spending, actually Labour's proposals are relatively modest to the radical thinking that you're outlining?
Well, I wouldn't say what I'm saying is radical. I think it's what a lot of people are suggesting. Actually, there is nothing unusual about saying we've got to predict in the longer term what the demands are going to be on the health service and plan accordingly on our budgets.
Should we increase our healthcare spending as a proportion of GDP to the levels of Germany and France?
Well, we're at the European average or thereabouts.
To Germany and France, which is above what we spend.
I don't think we should take this as a target. We should do what is appropriate to get the best NHS that we all depend on. And I think it is inevitable that into the future we will be spending a bigger percentage of GDP on health as we see the population continuing to age, as we see more expensive new treatments. I think we all depend on it and we're all going to end up spending more on it.
Justin Madders, thank you.
Thank you.
And if you want to find out how your local hospital is performing, you can use the BBC's NHS Tracker at bbc.co.uk/NHS Tracker.